Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Bakht. Today we are going to discuss how can we manage high cholesterol level. So we want to know about the cholesterol first. We have two types of cholesterol, the bad cholesterol and the good cholesterol. Cholesterol are important for the body function, but when they are an excess amount, more than normal, they can cause a lot of problems because they can lodge in the blood vessels and they can block the blood vessels, and it can lead to heart attack and it can lead to stroke. So what are the risk factors for the high cholesterol level? There are many risk factors for the high cholesterol level. When we eat more fatty food and we have sedentary lifestyle, when we don't do much workout, then we get a lot of fats unconsumed and which can build up in the body. It can block the blood vessels, it can be accumulated under the skin, and it can create a lot of problems. One is genetic history. Some people have genetically more cholesterol and they are called familial hypercholesterolemia. Some people have high cholesterol because of the high food intake, decrease in the exercise, decrease in workout, sedentary lifestyle. Some people have some diseases, for example chronic kidney disease, diabetes, hypothyroidism. All these can lead to high cholesterol level. So how can we diagnose the hypercholesterolemia, and at which age the cholesterol level should be checked? So cholesterol should be checked from 9 to 11 years. It means during childhood for the first time, and then every 5 years. From the age of 45 to 65, it can be checked from 1 to 2 years, and above 65 it should be checked annually every year. So what are the different values of the cholesterol and how the test is performed? So we do overnight fast, the fasting cholesterol level for some patients, and some people don't need the fasting cholesterol. We just do it straight randomly. So there are different levels of cholesterol for individually for different patients. Those people who have history of heart disease or history of stroke, then the bad cholesterol, which is called LDL, the low density lipoprotein. First of all, we want to know what is these lipoprotein. Cholesterol is present in the blood, and this cholesterol is carried by a special protein which is known as lipoprotein. So there are two types of cholesterol. One is called LDL, the low density lipoprotein, and other is called HDL, the high density lipoprotein. The LDL is known as bad cholesterol and the HDL is called good cholesterol. LDL is called bad cholesterol because when it is present above normal, it can block the blood vessel, it can lead to heart diseases, it can lead to stroke. The good cholesterol, the HDL, the high density lipoprotein, it takes the cholesterol to the liver. It means it clears the blood of cholesterol. So it is called the HDL. HDL should be high because it is a good cholesterol. Now what are the different levels of the LDL? So as we discussed, it should be decided individually. People who have heart disease, who have stent in the heart, who have history of stroke, then we say less than 70 milligram per deciliter should be the value of cholesterol. It should be less than 70. People who have diabetes, it should be less than 100. And normal people, the normal population who don't have heart disease, it should be from 100 to 129. Now above 129 to 159 is called borderline. Above 159 it is high. So borderline, high, very high, all these are not good. And when we get this level of cholesterol, then we ask the patient to adopt lifestyle modification, decrease in the fat intake, quitting smoking, quitting alcohol if somebody is drinking alcohol. And if there is any disease like hypothyroidism or chronic kidney disease, then we treat the diseases individually. So these are the different levels of the cholesterol. Now let's suppose if somebody is having high cholesterol, how can we manage it? So it can be a child with obesity, they have high cholesterol level, or it can be adult. So as we discussed, if there is a disease responsible for the high cholesterol, for example, we say hypothyroidism. Thyroid is a gland here. When it makes less than normal thyroid hormone, is called hypothyroidism, and a person get obese and they have high cholesterol. So we treat the thyroid disease, hypothyroidism, and the cholesterol levels get to normal. Now if somebody is drinking alcohol, we advise them to quit alcohol. If someone is eating junk food, more snacks, we advise them to start eating healthy diet. So these are different ways to decrease the cholesterol level. And the lifestyle modification, decrease in fat intake, regular exercise at least for 30 minutes daily, brisk walk, jogging, going to gym, all these are the different measures with the help of which we can decrease the high cholesterol level. Now if the cholesterol level is not decreasing despite of the lifestyle modification, then we we prescribe some medication in the name of statins, with the name of ezetimibe, and different medications are available. For example, statins are the medication which blocks the synthesis of cholesterol inside the liver, and other medication decrease absorption of cholesterol from the small intestine. So all these drugs are responsible to decrease the cholesterol. Another fat in the blood is called triglyceride, and it is also responsible for the heart disease and stroke. So we measure the triglyceride level as well, and there are different medications available. Same way as we discussed, these lifestyle modification, they decreases the bad cholesterol and the triglyceride, and they increases the high density lipoprotein, which are good cholesterol. It must be high. So this is an overview of the high cholesterol level, because people come to us and what they say when they can check the cholesterol level. So cholesterol level should be checked in the early childhood, like normally from 9 to 11 years, and after that every 5 years, and from 45 to 65 years. If somebody is not having family history of hypercholesterolemia, heart attack, it should be checked annually, or 2 years and above 65, it should be checked every year. And we mentioned the different values of the cholesterol. So optimal, it should be less than 130 for normal people. For diabetic, it should be less than 100, and for people having heart disease, history of heart attack and history of stroke, it should be less than 70. So these are the different reasons, and also the preventive measures which we can adopt, and we can decrease the high cholesterol level. Thank you so much for watching and listening. Bye bye.